There are 3 comfort measures for labor that are most effective according to numerous studies, and today I'm talking about one of my absolute favorite ones, the TENS machine. If you've heard of this little guy and are curious about how and why it works for labor, or you've never heard of it before but you're looking for non-pharmacological options to relieve pain during birth, this is a video you don't want to miss. I'll be sharing why it works, how to use it, and tips to get the most out of it, and also my own personal experience using it. So stay tuned. Hi, I'm Ashley, and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto area. And I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to birth and parent like a boss. Okay, first let's talk about what this is and why it works. So TENS stands for transcutaneous electrical nerve stimulation. And what it essentially does is send electrical pulses through the electrodes that you attach to your body, up your spinal cord, and to your brain. We think it works through what is called the gate control theory, which proposes that there's only a certain amount of stimuli that can get through to your brain. So essentially, there is a gatekeeper that will stop stimuli from reaching the brain if there's too much happening at once. So by using a TENS machine, you're sending stimuli to your brain and overloading it with information so that when your contractions pick up, the gatekeeper says no more and closes that gate, keeping the pain threshold much lower. Now, this particular unit is called the OB-TENS, and it is an obstetric-specific TENS meant for birth that all of my clients have the option of using. I will generally leave it with families that are last prenatal so that they have it when labor starts, and so that they can also play around with it before birth and kind of see how it works firsthand. So it comes with the main unit, which is this guy here, a neck cord, and also the electrodes. And what I love about this unit is that it's light and super simple to use. So essentially, what you do is you attach the electrodes to the cord that then attaches to the TENS machine. So you can see I've done one here. You have a red and white pin on each side, and what you want to do is connect one red and one white pin to each electrode. And then once you've done that, you just connect the other end of the cord to the TENS machine. And there's only one way to do it, so just like that. So now, how to place the electrodes. You want to put one pair on each side of your spine. So one just where your bra line is, and the other one in the middle of where your underwear line is. I'm going to demonstrate on myself. So this won't be perfect by any means because I don't have eyes in the back of my head, but it will give you an idea of where they should be placed on a real live human. So you have your bra line and you have your underwear line. And what you want to do is take the electrode and place the first one right at your bra line and the second one kind of in the middle of where your underwear line is. And you can see I have one white and one red pin on this side, and you want to do the same on the other side. So I have both white pins at the top, but it really doesn't matter if you have the white or the red pins at the top as long as you have one white and one red pin on either side. Now, once they're in place, you can get started by just pressing the on button up here at the top and then setting the intensity that you want with these arrows here. So it goes all the way up to level 10. I recommend starting low at first and increasing as your labor progresses as you need it. You can also use the boost button, which is this guy here, during a contraction, which just adds a little bit of oomph to the pulses. So on the regular setting, the sensation will feel like tingling pulses. And during the boost mode, it actually becomes one long continuous pulse to help combat the contraction pain. And of course, you have the neck cord, which is really handy. So you don't have to carry this around in your hand when you're in labor. You just kind of pop it over your neck and move around as you feel comfortable. So a couple things I want to mention. I recommend starting this early in your labor so you can get the most benefit out of it. Remember that how it works, it is meant to overload your brain so you don't feel the pain as much. And so you want to be sending stimulus to your brain before your contractions or surges become overwhelming. You could use any TENS machine. There are a lot of different ones on the market at different price levels. However, I recommend for birth getting one specifically made for birth because it has that boost mode, and because it's so simple to use, you don't even have to think about anything other than, pressing a button when you're having a contraction. And really, you don't want to be thinking about much else when you're in labor. Like I mentioned, I give every family that works with me the option of borrowing one for their birth, which works out nicely because I find people either really love or really hate it, and this way there's no investment for them. Although I have used this outside of birth for other types of pain on myself, and it has worked. So like I said, any TENS machine that you can place electrodes on either side of your spine will work for your birth. So if you already have one, by all means, you don't need to purchase another one just for your birth. Another thing is that you can use the TENS machine with other comfort measures with the exception of water. Do not immerse this in water. So if you are planning to use a tub or shower, you'll need to take it off and put it back on once you get out. And you can totally alternate between the two if that's what is working for you. Make sure that you keep the little plastic pieces that the electrodes come on, so you can place the electrodes back on the plastic if you take them off, and that way they won't dry out or stick to anything else and stop sticking to you, so you can reuse them. As well, I mentioned that I recommend playing around with the machine before your birth. However, there is a difference between what the pulse feels like when you're not in labor versus when you are in labor. If I were to place these on my spine now and turn it on, I would want to rip them off. But in labor, it was completely tolerable and even a welcome sensation. So if you try it before your labor and don't like the way it feels, don't immediately discount it. I recommend trying it early in labor, and then if you don't like it, don't use it. And that's one of the great things about the TENS machine, is that there is no lasting side effects to it. So if you try it and you hate it, you just take it off and it's done, and you move on to something else that works better for you. Another tip is to have extra batteries. So I always include an extra set in the pouch with the TENS. So if you have your own TENS, make sure you have extra batteries just in case. I know it sounds obvious, but it's worth mentioning because I'm the type of person that always seems to have the wrong size batteries on hand. Now, personally, I used the TENS during my last birth, and it 100% got me through. So this is me at around 7 to 8 centimeters, so active labor. And I couldn't have told you it was active labor except for the fact that the contractions were fairly steady. But I was coping super well with my TENS machine and my birth ball and nothing else. So this birth actually ended up being a hospital transfer for unexplained bleeding. I'm not going to get into that in this video, but I can say that I did have to remove the TENS machine at one point at the hospital, and it was incomparable. I did not cope well. And I'm really sorry to all of the birthing people on the maternity ward that night that had to hear those absolutely guttural screams from me. Especially if that was your first birth, I am really sorry. So that's it. I will link to the OB10s in the description, and if you have any questions, just pop them in the comments, and of course I will answer them. Don't forget to grab your printable birth affirmations from the link in the description. And if you want more doula tips and tricks, make sure you subscribe. And don't forget to hit that like button and share with anyone in your life who is pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.